Europe is aging fast, yet our health data remains scattered across hospitals, various applications, and wearables. This fragmentation limits the quality of care, research, and innovation. We need a secure way to connect these silos while keeping citizens firmly in control of how their data is used. Citizens are constantly asked to click accept and share health data, but rarely shown where it goes or how to stop sharing. This erodes trust. A modern health data space must make consent understandable, reversible, and transparent for every individual. Imagine a Europe where health data flows seamlessly between providers, researchers, and services, but only with your explicit consent. Our vision is a trusted infrastructure that combines data mobility with governed, user-driven consent at every step and at scale. Introducing the Crane Decentralized Health Data Space Infrastructure, or dHDSI. It connects those who hold data, that is, data sources, with those who need it, that is, data using services, while enforcing consented data flows. It applies FAIR principles, making data findable, accessible, interoperable, and reusable, while ensuring exchanges are compliant, transparent, auditable, and well-governed. Powered by a data intermediation service provider as per the European Data Governance Act. My Health Enabler places health data in citizens' hands. It combines EU-wide digital identity, consent management, and EIDAS 2.0 compliant wallets with their services listed to governed data marketplaces. Validated with users in Sweden, Norway, and Spain, it enables secure access, clear choices, and insight into personal data use. Our data intermediation service provider offers trusted infrastructure for data exchange. It manages data agreements, verifies digital identities, and enforces consent before every access. Cryptographic controls ensure end-to-end auditability and regulatory compliance. The data marketplace lets organizations publish consented data sets under clear, legally binding terms. Providers register, define disclosure agreements, submit them for review, and once approved, their datasets become discoverable for compliant, value-creating reuse. From agreement to access, consent remains central. Data users first find a dataset, then sign a digital disclosure agreement. The intermediation service validates it, and only then do opted-in data flows begin, ensuring no party sees more than they are permitted to. Our architecture is built on trust by design, combining three things that have never been brought together at scale before. First, consent management. Citizens decide in real time who can see their data, and those decisions are enforced before any data is moved. Second, digital identity wallets. Organizations and citizens can leverage verifiable credentials for identity and the exchange of data across borders at scale, with end-to-end cryptographic trust. And third, a scalable, governed mechanism to seamlessly exchange data through legally binding data disclosure agreements, discoverable in the marketplace, and enforced and governed by the DISP. As EHDS and data space regulations converge, Crane already provides the necessary infrastructure, tested with real citizens, real organizations, and real data across Europe to support secure cross-border health data use. This is the Decentralized Health Data Space Infrastructure, or dHDSI, built for Europe, built for citizens, and built to last. Together with partners Nordic Health Innovation, iGrant.io, and Red Pill Impro, we deliver a robust, future-proof foundation for trustworthy digital health.